The CDC released a report today showing that racial disparities extend to children when it comes to the impact of COVID-19. Hispanic children were hospitalized at a rate 8 times higher than white kids, and black children were hospitalized at a rate 5 times higher. CDPHE couldn't provide specific data on children in Colorado tonight, but we know disparities do exist here when it comes to more broad state data. Hispanics make up about 21% of the state's population, but have 38% of the state's positive cases. About 4% of the state's population is black, but make up nearly 7% of the overall deaths. 9 Health medical expert Dr. Pyle Coley explains how this disparity carries over to children.
So, when we talked about the disparities in adults, we reached for things like a difference in underlying health problems like hypertension and diabetes and obesity. But that doesn't seem to be the explanation in children. So the most obvious and probably the correct explanation for why we might be seeing this occurring more commonly in these children is just because there's a higher prevalence of that disease in that community.
CDC officials stress that severe impacts on minority groups is not driven by genetics. It is driven by social conditions that Coley says should be addressed, especially as schools wrestle with the idea of reopening classrooms.
In order to really minimize the incidence of these disparities occurring within our kids, we need to first minimize them in our adults. And that's where access to health care, social determinants of health, socioeconomic differences, education, all of those tools are critically important, because if the adults don't catch it, they're not going to bring it home to their kids, and we're going to see these disparities disappear.
The CDC released a second report today regarding multi-system inflammatory syndrome, a rare and sometimes deadly side effect of COVID-19. It says nearly 3/4 of the children with the syndrome were either Hispanic or black.